Hey guys, it's Rich Segarra again with video number 3 on gastric bypass and his weight loss surgery for me. Last video I talked about, I was going into some of the frequently asked questions, and I'm going to continue with that. A lot of people sit there and as they start asking questions, some of the questions they may have is, if I want to undergo a gastric bypass, how long do I have to wait? And that time period, as a matter of fact, I started my, just looking into it and going to a class, February of 07. I didn't have my surgery till December. It's a long process. And here's some of the reasons why. New evaluation appointments are usually booked 4 to 8 months in advance. Once a patient is seen, if the surgeon and the patient agree it is appropriate, the operation can usually be scheduled within 8 weeks. I had mine done by the U.S. Navy, Portsmouth Naval Hospital. They are very, very stringent and very well, I won't say conservative, but it's one of the best gastric clinics on the East Coast. Why? Because they are very thorough. So why should you wait so long? Number one is they want you to go through the class. You know, some doctors are required to see you on a structured weight loss program for 6 months to see if you can actually lose the weight. After that period comes up, and it may be shorter depending on your doctor, then they have you see a nutritionist. They have you see a psychiatrist. You know, then the doctor actually meets with you, goes over the surgery, and discusses the procedures and gives you a lot more information. So it is definitely a long process, but well worth it. You know, and here's another one. What can I do before the appointment to speed up the process of getting ready for surgery? Select a primary care physician. If you don't already have one, establish a relationship with him or her. Depending on where you're at, once again, obesityhelp.com, they list all kinds of physicians. And I'm telling you, this is major surgery. So you really want to do your research. You don't want a general doctor. You want a bariatric doctor that does this on a daily basis. You need to interview them. Because, you know, just like any surgery, as minor as getting your tonsils out, okay, death can occur. So you want to make sure that the doctor you're dealing with has got years of experience, and ask them, how many have you done? How often do you do it? What's your recovery program? You want to ask them, do you have an aftercare program? How long is the aftercare? Which insurance companies do you deal with? These are questions you want to ask, because like I said, this is serious surgery. Okay, you want to work with your physician to ensure that your routine health maintenance testing is current. For example, women must have a pap smear, and if over 40 of age, a breast exam. Even for men, they may include a prostate-specific antigen test, a PSA test. This is to make sure you don't have prostate cancer. You want to make a list of all the diets you have tried and bring in that history. They want to know what you have tried to do to lose the weight. Okay? Bring in a list of your medications with dose and schedules, because after surgery, there's a lot of medicines you cannot take. I can't take ibuprofen. My system can't process it. I have to chew all my vitamins. I have to take protein shakes, which is perfectly fine. Stuff does not stay in your system long enough to break down. And so, when I said ibuprofen, because Motrin can cause ulcers, bleeding ulcers. Well, remember, your stomach's not big at all no more. It's about the size of my thumb after surgery. So, now here's another thing. You may sit there and you're going through obesityhelp.com. You're finding more and more that you are eligible for the surgery. Now you got to look at insurance issues. What does it take? All right. Why does it take so long to get insurance approval? After your telephone interview consultation is completed, it usually takes a doctor 1 to 2 days to send a letter to your insurance carrier to start the approval process. The time it takes to get an answer can vary from about 3 to 4 weeks. So, like I said, this is not something that happens overnight. Most insurance companies, if you qualify, will do the surgery. But one thing they will not do is they will not do the reconstructive surgery, the cosmetic stuff, like after about a year, you're where your ideal goal weight is, and you have a whole lot of flabby skin. A lot of insurance companies won't carry that unless it still causes a health issue. So that's something you'll either have to live with the excess skin, or work payment plans out with a plastic surgeon and get that done. Okay. So now, what could you do to help the process? Gather all the information, diet records, medical tests your insurance company may require. This reduces the likelihood of denial, so you want to provide them as much information as possible. Now, let's talk a little bit about the surgery. Does laparoscopic surgery decrease the risk? No, laparoscopic operation carry the same risk as the procedure performed as an open operation. The benefits of laparoscopic are typically less discomfort, shorter hospital stays, earlier return to work. I had 6 weeks off. The doctor recommended. I was back to work after about 4. Because I sit behind a desk working on computers. And when I'm home, I also have my own home-based business. I'm in the travel industry. So I can sit at the computer and I can answer to the phone. And I could teach people how to create their own economy. So my work wasn't a physical, job. So here's another thing. Will the doctor leave a drain in after surgery? You had a lot of work in your stomach, so there's going to be a lot of drainage. And they put in what they call a JP tube, JP drain. Most patients usually have a small amount of drainage, and they'll usually leave the drain in, until you go home. But if you're still draining a lot of times they'll send you home with the JP drain in, until all the draining's done. Okay. So that's the good amount. That's some information on gastric bypass, and kind of the procedure about investigating it and if it's for you. Really, if weight is a major issue in your life, it's affecting everything. Your relationship, your job, and you are severely overweight, maybe this is for you. The next series of videos I'm going to talk about, I'm going to walk you through what I went through. And you may be able to relate to a lot. I'm going to share some pictures with you. And also, I haven't mentioned yet, but I do a lot of ministry work. And if I continued to gain the weight, then I'm more of a liability as I'm out there and ministering and out there, sharing the gospel. If I go out and help a church that might have been hit by a hurricane or something like that, I'm more of a health risk. I'm more of a liability than I am helping people. So you really want to think about all the reasons why you may be thinking about weight loss surgery. But I'm going to walk you through what I went through and the blessings that the Lord has put on me. Okay, here's some more pictures of after, what I look like after. And I'm going to gradually share more and more and more. So you guys have a blessed one. Like I said, subscribe to my channel. And if you got any information, my email is now on the screen. Feel free to shoot me an email. All right. God bless.